No, the recording's in progress. I apparently can't multitask, so I missed the pledge. We won't do that again. So we called to order at what time, Jean? 6:30? 6:37. So on the agenda, I kept it basic because I really figured we should meet and see, if there's anything that any of us could suggest really to help with the current pandemic, because I know we're right back to only focusing on that. So as far as the roll call, I'll let Jean, if you want to just take it.
Dr. Muhammad, Heather, Shay.
Yep.
We're on the list, and myself.
Okay. And Kebby had another engagement, and I did not hear from Kathy. So the review of the minutes, could we consider deferring that until the next meeting because of the issue with the recording and everything? Jean was having a hard time getting a hold of them to review. Is that okay?
That's fine.
So we'll review November and January's at our next meeting. So sadly, old business, we'll go back to COVID-19, local data, vaccination, outreach. I know, Maureen, I'll turn it over to you. I know you've definitely had your hands full.
Yeah, well, thank you, Heather. So, I think Dr. Muhammad will agree that I feel like we're back to square one, or we're back to a place I thought we wouldn't see again. And if we're saying that, imagine what the healthcare providers are saying. So just to give you some quick data, our average daily caseload in West Haven is just below 300 cases per day. That we didn't see those numbers in March and April of 2020. We have 4 or 5 contact tracers, and they're doing the best they can. The good news is that the state will help out after 48 hours. So we try not to let them sit too long without being contacted. Problem is now with the shorter guidance, my concern, and we're working on, I think, a strategy for that is, getting to them before they're out of quarantine or isolation. Rather. Right. So our case rate is like 262. Like that isn't even, Amir and I, we've taken statistics, we've taken biostatistics. Like I can't even wrap my head around what that means. That's how significant that number is.
That is even the home tests, because I know our whole family tested positive, and that's not reported anywhere.
There's no data for that.
We have, it's interesting though, there are people looking to report their home test, which I find very refreshing, and I'm very happy to take that information. It hasn't happened often, but we do get a call or two. I don't even know what to say. It's a lot. It's out of control. The way I'm looking at this, when I talk to people, I say, look, pretty much assume everyone has it. They just may not know about it. That's how cautious you should be. And it's much more transmissible than Delta Omicron, because it's not even a matter of 15-minute conversation anymore. It could be a transient encounter. So the mask strategy should be, if you can't get an N95 or KN95, double mask.
Double mask. Okay.
Yeah. Just to let you know, all of you and the community, that we have clinics set up around the city between hours at Noble Street on Fridays and Griffin Health, who was in Allentown today. I went over there at 10 o'clock to greet them, and there was a long line. I was very encouraged, very encouraged. I came out of there at 11 o'clock, and there were people, the parking lot was full. I was very happy. We're going to do more of those.
And Cornell Scott is January 22nd. They're having a family vaccine clinic. I just got through the schools
Okay, that's good to know.
on Campbell Avenue. I just got that notification today from the, I guess.
Are
was
they
the-
doing it at Cornell Scott?
Yeah, it's on Campbell Avenue. Yep.
Okay. We have a flu clinic this Thursday for the public, the community. It's going to be at the West Haven PD Community Room. And it is 10 to 2, sorry, 10 to 2. And then Monday, there's another Griffin Health Vaccine Clinic, also at the West Haven PD in the community room from 12 to 4. And then going to schedule, we have another on the 21st on Friday at Noble Street. Every Friday we're at Noble Street. You know, we find that by sending out the Everbridge calls that we get a good response. I know that I don't know if everyone likes getting robocalls, but we find that it does help get the word out. And we're gonna schedule more clinics from by Griffin, and we're gonna do them around the city. We also talked about, and this is something that with the cold snap now, the planning today, we got a little sidetracked, but I asked Mary Kate, Elaine, and Joe if we could do a clinic with the CERT van. Just go out, and we haven't come up with logistics yet, but just go out with the van. Almost
now,
like
we
an
did
ice cream.
one previously in Meadowbrook before, not with the CERT van, but Meadowbrook, and then at Juneteenth, right? So similar to the idea of that, or literally on the van?
Literally on the van.
Nice. That'd be good to get out into neighborhoods, because I think that's the one piece we haven't been able to do. So now with that nice van, that would be great.
Yeah, it's a pretty good sized van. You were on it the other night. It was
Yeah.
pretty.
Yeah.
Yeah, pretty good. That's I think that's my biggest message is the vaccine and the booster. It's available, and we're planning a lot of clinics. If anyone has any suggestions about what we could do to where you think we should have them that we haven't been yet, please let us know, because we definitely want to get it out there.
Is there anything connected to the school somehow now that the school, like at least the high school, because they're now like eligible for boosters where they weren't before? I've actually been trying to get my son a booster, and I haven't been able to get him an appointment yet.
Well, I think that's what Cornell Scott is.
I was just going
Cornell
to say, that was their point. June 22nd, I'll send the, you might have gotten it too, from Dana today.
I think I did. I just didn't read it yet.
It's Cornell Scott, January 22nd. I don't know the hours, but it's specifically geared for that reason. And it's worked out through Board of Ed that I guess they worked that out. Rather than doing I'm only assuming this, but rather than doing what they did on site a few months back, maybe they just decided to try it at the new clinic that's now in Campbell Avenue and see how that goes. But it's walk-in too. It's not appointments needed. It's a walk-in clinic. So
I think the clinics are good, because even like now that Yale has mandated that it's required, a lot of my coworkers are still having a hard time trying to get appointments, getting boosters, you know?
Yeah, and Jean, the Griffin Health Van is vaccinating people 12 and up. They have all three: Pfizer, Moderna, J&J. They're doing boosters. If you're comfortable with that format, they're going to be, I'm going to have them back. I may even have them come to City Hall or the Green, but they will be here on Monday the 17th. I'm just praying we don't have any sort of snowstorm.
Okay.
But yeah, they're very easy to work with, and I was there with them today, and I was impressed with their setup. It was so easy, and again, it was a good turnout. What I'm trying to find out is I want to get in touch with them so that every time they come to West Haven, I get a record of how many people they serviced, because that would help me a lot.
Yeah.
I haven't gotten that before, but I'm working on it because that would help me to know.
Can I, speaking of numbers, can I go back to just ask the numbers that you're seeing, is that statewide? The numbers are that high pretty
Oh,
much
yeah.
right now?
Oh, yeah. Well, Dr. Muhammad, I can speak for Orange. They have a 165 case rate. Right. What are your daily numbers, Dr. Muhammad?
Yeah, I mean, so I ran the database from CTEDSS from Jan 1st till yesterday, 60 cases. So the cases are still, I mean, this is 150 times higher than what we had been seeing on a weekly basis. Almost looking at the, per 100,000, it's just too much, too many cases. Now, on top of it, I just wanted to inform the group, this is just the tip of the iceberg. We don't know the home test unless somebody reports it. So the school is reporting me with both in-home testing as well as the PCR, the lab confirmed. I mean, we get the lab confirmed cases through the surveillance system, but we would not know until parents or other. So the other source of number of cases is basically, so my intern would compile all the data on a monthly basis to kind of review where the trend is. So that's not it. The 60 cases that I know are the lab confirmed, but you add another 40 or 50 cases from the schools among all the elementary schools that I know of.
Mm-hmm.
So in a week, 100 plus cases, roughly.
Yeah, that's about, there are towns, they're all about the same. There's only one town in the state that has still less than 5. I think it's
Is
Canaan.
that the one up in the northern?
Yes.
I see that.
Yeah.
one gray spot.
Yeah, that's it.
Yeah. So, and the boosters, if you get the boosters, if you're beyond the 6 months, science is showing that it's definitely protecting you from getting as sick, but not necessarily getting infected. You still could get infected.
Still can get affected, yeah. And just, I think it was Pfizer who changed it to 5 months, right?
5 months, that's right. It just changed.
Yeah. And yeah, I mean, yes.
Moderna changed it to 5 months.
Yeah.
Pfizer had been
did
5
too.
months. Moderna did the check. Yeah.
And the other question I wanted to ask about the numbers, the people who are getting sick, the hospitalizations as of today are higher than they've ever been, correct? Or higher at the highest point as it was.
Yes, they are very, yes.
So
yeah, I mean,
it looked like in the beginning that with the Omicron, perhaps we weren't going to have that, but we are starting to now see very ill even with the Omicron.
I saw recently there was because I check the database every day when I'm at work, and there was 600 inpatient COVID at just Yale. But then today there was 400. So they did say that although they're coming in large amounts, the length of stay and the length of, how long they have to be there are not necessarily as high. I don't know if Dr. Muhammad, you can confirm or deny that.
Oh, you're muted.
Yeah, that is correct in a sense that there are huge number of cases. My colleague texted me saying Amir is like a war zone in ED. I 100% agree with that. So there are more cases coming in. The severity in general are lower among those who are vaccinated, but there are 60 people who ended up in ICU.
Okay.
I don't know fully the status, but another colleague of mine who's also part of Board of Health tells me the majority of the patient that he's taking care of in hospitalist service are sick, severe because of their unvaccinated history.
Those are the numbers that I was seeing. So I wasn't sure if that was still the case or if we're starting to see vaccinated too. But I mean, that's just another message for why we need to get the vaccinations in the arms.
Right. And those people who are against it kind of keep saying the same nonsense is that you still get infected. You still get infected, right? I mean, nobody's saying that there's no risk for getting infected, but the positive sign is you don't end up dying, you don't end up going into ICU. So that's a distinction that is somehow conflated with other stupid reasons and politicization, and that's the struggle. I mean, again, some parents are emailing it because of the mask policy. You know, these are the unmask our kids type of group, right? Saying the same mantra that children don't get sick, children don't get sick. And today I was just reading an article saying that, for those who get infected, they have quite a big chance of developing autoimmune phenomena. And autoimmune means that it can affect your joints, it can affect your skin, it can affect your, nerves. So I just want, I don't know why this information is not being distilled into layman term from, our policymakers. And that's the concern. These are just a preliminary research done on the availability of subjects. We're not doing randomized controlled trial for that matter. So the after effects are much severe in terms of autoimmune, and there might be more chances of our children, God forbid, becoming more prone for type 2 diabetes, knowingly that there is some other risk factors, childhood obesity and all those things that may make them even more prone if they get infected. So yes, they're not dying from active infection, but do you want to wait until that happens? It just doesn't make sense.
And I have heard, and I mean, maybe it's just, where I'm reading, but my understanding is that the numbers of children hospitalized right now is actually significantly higher than early on in the pandemic. And so that's the exact opposite of what some people are saying, is that the children are getting sick because they're being hospitalized.
Yeah, the pediatric cases, yes.
So,
True.
yeah. I just keep saying, please get vaccinated to everyone who listens, because boosted, vaccinated, just protect your family.
Right. Yeah. Just one is better than zero. People don't realize it. Those who are, my threshold is those who are on any type of chronic medication for whatever reason should be boosted. That's sort of a bottom line is, regardless of your allergies, headache, what have you. If you're taking a medication, blood pressure, anxiety, what have you, on a routine basis, on a regular basis, should maximize their immunity level with, vaccination that is available. That's why the threshold is changing. They're encouraging sooner rather than later. But yeah, if you're healthy, otherwise you don't have strong risk factors, you should get it. You can prolong, but not too much that, it loses efficacy. So, consistent message is what's needed to be coming out. But a state like Connecticut, we thankfully, it's not as, it's bad, Maureen, but I was talking to my friend in Georgia. Imagine what's going on with their school system. He's like, he's a physician himself. And he was asking me, what are you guys doing from public health that I can educate my principal in a private school system, because their parents, he sends his kids with masks and everything, but not others, majority of them. So it's even worse. I just can only empathize with them, what they have to face. At least we have mask mandate in school. Every day I get the email notification from our nurses, positive cases. So it's it's bad in Connecticut, but it's actually worse out there.
So in Georgia and some states, they don't wear masks in schools.
No.
Wow, can you imagine that?
And 2 months ago, another friend who lives in southern, one of the largest, it made it up to a CNN story, in the largest county with school district, some parents had to protest about allowing the mask to go to school. Now remember, these it's weird because their governors or their administration have somehow are penalizing and withholding funds if they implement masks. Stupid, but and again,
Florida was doing that.
Yep, I think it's still doing it, right? They haven't.
Florida, yeah. And the other,
I know. now I
sorry.
know what states I don't want to live in after I retire. That's exactly what I was telling this is exactly what I don't want to look at in terms of stupidity and, not looking at from the scientific standpoint.
I have
The
a
other-
question, if
Yeah.
anybody has any input on this. I mean, I don't know. Many of my coworkers have kids in daycare, and they're still doing contact tracing and, closing rooms for a positive exposure. But, these coworkers are literally having to every other week be out of work to be home with the kid who was exposed. I don't know what the real solution is, but it's definitely not conducive to any good situation for anybody. And it's happening to, anybody who has a child in daycare. It's just the repetitive, cycle every other week.
Well, I know
So
that the childcare centers are not following, they're following the 10-day
Mhm.
guidance, fortunately.
And they're
That is
continuing contact tracing, right? Because they can't be vaccinated for the most part, those kids. So they're
Correct. A lot of
Correct.
them are babies under 5.
Yes.
That's right.
It's not, Jean, you're right. It's just, there's no good solution. It's not easy.
It is difficult. Yeah, it is. However, I must say this, that the new guidelines with reduced quarantine or isolation time along with vaccinated people, right? So if you come across with somebody who is positive and you're fully vaccinated, your last vaccine was less than 6 months, you can carry on working with appropriate public health measures or mitigation strategy. You don't have to quarantine, right? So that's another upside of those workers who are up to date with their vaccination status, especially in these high risk industries, education, healthcare, police, and all those. So yeah, I mean, that's what they are recommending, and I think there's some degree to certainty about protecting essential workforce, and they should get tested on day 6. Yeah, that's the other caveat is, you can come back to work, help out, but keep wearing the mask, all the other hygienic factors, and get tested.
I have to admit, when I heard there was the couple changes that I had heard most recently, which was the 5-day and the not contact tracing, my first instinct was, oh my God, this is crazy. But when you look at the science, my understanding is you're most contagious right before, right, symptoms,
Mhm.
and right after. So the 5 days does make sense.
Well,
But the testing you're talking about for the exposed person to return after the 5 days that's not vaccinated, not because if you're vaccinated. Oh, so vaccinated too.
yeah, both. The current guidelines say that get tested, even if you're not quarantining because you've been fully vaccinated.
Okay.
So yeah, which is again trying to reduce the burden. But if you become symptomatic and you have any change in your health status, that's when you have to believe that it's coronavirus until proven otherwise. That's what the threshold is, unfortunately. But we will see what we will find. But yeah, it's not something that one should pay lesser attention, because it should be equally held to that level by routine or daily symptoms monitoring as well, along with if they're coming back with work.
Can I ask a question about the testing? Because I've heard mixed information.
Mhm.
The home testing, is it sensitive to Omicron?
I don't know for what percentage, but it is detecting. So the bottom line is there's not just one variant, there's other proteins, right, that have been mutated and all that. So it does detect some of the antigens. It's a lateral flow testing, right, detecting the antigen of the virus. So yeah, it's coming back positive. So you, with all these massive number of positive cases in home test kit, it seems like it is detecting it to some extent, because the actual variant does have other old proteins that it carried on, but the predominant, the circulating virus, because the way they mark the markers are that they label this alpha, beta, delta, omicron, that makes it a little different, but it still carries the other antigens.
Okay. Because I try to read like WHO and I try to read CDC, but you end up reading some other stuff and it's like, I don't know, what's
Maureen and I discuss all the time. There's a lot of reading. Sometimes I don't catch up on things that Maureen has identified. I'm like, oh yeah, let me go back and read it, and vice versa. There's so much to do. But in the presence of symptoms, mild symptoms and what have you, or that you were in a gathering that later you found out unprotected, obviously, and you later found out that there was person. Those are sure signs, or at least telling signs that you should get tested. And if it's positive, it's true positive.
And the other statistic that I wanted to ask about is it still accurate that the high number of ICU patients still remains unvaccinated? I know we talked about hospitalization and stuff. The ICU at one point was almost 100% unvaccinated when Omicron first started to blow up. Is that still?
I think it's 75%, if I'm not mistaken. I don't know the exact number, but last time I heard it was 75%. Yeah, still high,
All arguments to get that shot. So
I just
experience reason not to.
that I've seen is that like we treat a lot of multiple myeloma patients, and a lot of them are very, very compromised. We've actually lost like 3 this week alone, one of which ended up being positive for COVID, and she, decompensated very quickly, and she was boosted. So I think of the people that are boosted and, in the ICU and or are positive, have other significant situations that are attributing to that.
Sad, very
I'm
sad.
sorry to hear that.
Yeah,
that's horrible. The magic question is, are we foreseeing a peak or an idea equal?
I mean,
we should.
We we're hoping we will. So I think that what I think we're really going to start to see a decline. I would say I'm predicting after Super Bowl Sunday.
Good point.
That's just because people are.
End of Jan, most likely based on the experts' opinion, and also what triggered in the UK, in terms of the peak and then trough coming in after the fact. The smartest strategy is to sit tight, hold tight when the peak is ongoing, or at least it hasn't reached the highest peak, and then trying to relax after you have started seeing. I have a telltale sign that I check when state presents the data with week 1 and week 2, and I share that with Maureen also. When my week 2 numbers are higher than week 1, I know things are not going the right direction.
Right.
So I have to wait till I see, at least for 2 weeks consistently, that the week number 2 cases are going down compared to week number 1. And that's the surety, at least in my experience, looking at the data for almost a year, that we're looking at downward trend. And that's what I tell the school system: look, don't let your guards down. They haven't, but at least there was a question about how do we distribute the limited supply of those testing kits to they're not. I mean, we distributed it, as Maureen did it as well for West Haven. We did it for Orange. First come, first serve. We didn't even cover 50% of the population with the testing kit, right?
Right. And so, we gave them also to the school. The school system got their own distribution.
They got their own allocation from the state, correct? Yeah, thankfully, yeah.
And are they using? Is the plan now in the schools, if they're symptomatic, the nurses have the ability to test now there, or do they send it home with the kids?
I don't know what the
don't
nurses
know
are
that.
doing. They're
Yeah, I don't know.
Yeah.
I just didn't
email
know
that
what
we got,
if they were sending it home or if they were actually testing there.
the email that I read somewhere, I don't remember where it was from, said that they were going to be sending it home if a student came sick. I think it might have been from Dana, but I'm not sure.
Yeah, there's been a lot of emails. And my other, just a question I have, is there any truth, not truth, but any reality to possibly once we get past this peak, the immunity will be higher, the herd immunity per se, because of all this?
Yeah,
we,
like
we
who's to
hope so.
say, who's to
We-
say there's not going to be another variant in 2 months from now that's going to be, how does that stop? When does that stop?
That's my question. I mean, is this ultimately potentially helping us reach where we need to be to make it endemic?
Pandemic.
That's what the likelihood is. I think it will become endemic. Town like Orange, where 80% of the folks are vaccinated. So come summer or come next or this year's November, or winter, we have a newly manufactured vaccine with whatever the circulating strains are in Australia or other parts of the world, and we get it just like flu, right? Influenza, and that we would know that it is becoming endemic. People may get infected. We will have pill, right? We have an oral medication, antiviral, to reduce the severity of the symptoms. Again, it's not a prophylaxis, it's a treatment to reduce the severity of the illness. And that's how things will get back to normal. Nobody will die. ICU will not be filled with these cases, but the threshold is what, 80% plus. We don't know. I mean, this is the normal definition of herd immunity, that you have enough vaccinated people that the circulation or transmission would die off. Because if one semi-healthy person infects a healthy person and a healthy person overcome the infection, he or she is not going to pass it on. Their immune system would. So you need your healthy people there as well to be vaccinated, right? Along with your unhealthy people who may have more symptoms, and depending on the matching of the vaccine. And that's just every year's battle between influenza vaccine and the circulating strain. If it's a good match, we get less amount of acute hospitalization. If it's a poor match, which had happened in the past, we see tons of people showing up at the hospital, right? So we have to deal with that, and some of them, along with others, may die because of underlying COPD and other. So this phenomena will carry on. I guess it's not like MERS and other coronaviruses that were specifically with animal reservoir like camel and others. They're still looking at the intermediate reservoir. So a lot to learn, but at the same time, I'm hoping, to some extent, there's somewhat new normalcy if we have that threshold, which means that there's not going to be active transmission in a household. There are 5 people who are healthy otherwise, and children will play a big role also if they're vaccinated. So so 5 and above can get the vaccine, right? And hopefully later part of this year, when we have kiddies, under 5, with some sort of vaccine that will also cover that. So we have to go from 0 to 100, right? Cover everybody.
Yeah.
I think that this maybe sounds negative, but I think it's not meant to be. I think this is not going to leave us.
Right.
So what we have to do now,
Live with it, yeah.
talking about an endemic, we have to be proactive instead of react.
Yeah.
And I think that we have to learn how to live. Right now, it's a bit chaotic, but as Dr. Muhammad explained, I think at some point we're going to get to a point where it's manageable. But
right.
We still always have to be careful.
Right.
Yeah.
No, I don't really see, unfortunately, a time before COVID.
And that's, I mean, I think that was kind of my question, because that's kind of what's mentally getting me through this, is because so many people are getting sick, and it feels like whenever you're talking to someone, it's like, oh yeah, my brother is, just negative, my,
Right.
whoever is negative. I'm like, okay, but once we get past this, maybe we're going to be going into a point where we have so much more in our arsenal, like you said, with the medications that can help the symptoms, the vaccines. We know what we're doing better with the vaccines than we did a year ago.
Right.
So,
Right. So you're right. And from global health perspective, we need to wait until rich countries will start donating those vaccines sooner and quickly. Right now they're still struggling to get, there's a lot of wastage as well in the US and but we need to get those poor countries vaccinated too. So
right,
so it's a race against time.
right,
Where did this Omicron originated?
yeah,
South Africa, right? So, and this may happen in, Delta originated in India.
Yep.
So the point is one is in Africa, one is in South Asia, right? So all became transmissible up until Northern Hemisphere. So it's interesting how quickly these viruses can travel. But to get the herd immunity, and that's not just for the US, we need to look at the global herd immunity. And that would be the time when you would say, you know what, we have come to a new normalcy. Because I'm just thinking, if I travel internationally, which I haven't done for the last 2 years, but I do have family members in Europe and Asia, what the heck I'm going to do? I mean, I know my family, they would be vaccinated, they would be careful, but what if you're just going out shopping or eat? I mean, there's so many things to kind of look at, but we have a very narrow lens. I mean, by we, I think majority of the public has very narrow lenses, and they say, oh, we can live with that, we don't need a vaccine. But think about, when you travel for all these vacation spots and all, they have different, they have different, and quite frankly, I think some of the resorts and some of the other options are mandating those vaccines results or testing and all those things. That's a big hassle too. So it's going to be really, really interesting to see how the global health policy would come into play to curb this pandemic. Pandemic, it's called because it's global. It's not epidemic or endemic to restrict with one country or one continent. So that's the key, to have other poor countries or developing world to have access so they can quickly vaccinate.
Is it starting to happen at all, or are they still?
I mean, they're still struggling. I think, unfortunately, with it was a good pace until this Omicron hit hard, these poor nations out there. And now, the cases are jumping. I look at, I have some families in Pakistan. There's a wedding that my niece is getting married. I cannot see, because the cases are 100% every day increasing. So this is just an example. Again, India is the same thing. They are just struggling with the mass population, lack of care, and the second largest or populated country in the world after China. We're talking about, right? 2 billion people. So a lot needs to be done before, I think, globally we will come to terms with this virus. And all these tools in our toolbox would play a role. Perhaps if I travel internationally, I'll take Paxlovid, the newly approved. Keep it with you.
And we are administering that now, correct? Actively in Connecticut, if needed?
That's a good question. I do not know that. I don't know if this will be that soon. I think it will start coming in, but I don't see it's being prescribed because it's not available as at this time. I think the distribution will take some time, but it should become available if it's been approved. Yeah, a lot has changed and a lot needs to be done.
So I guess, we got a lot of questions answered and some information about what's happening currently, but I guess before, one thing we should talk about is what can we do to help West Haven as a board, as a, you know, just what can we do? I mean, Maureen, you know, like, what do you want me to do? I mean, and we all work, obviously, full time. What would be the most helpful to the health department that, you know, we can do?
I mean, that's a difficult question to answer because what we need is hard to get. We need people out in the neighborhoods where people aren't vaccinated, trying to convince them. But here's the other thing too about convincing, okay? Interesting story. I was speaking with a gentleman not long ago who said, you know, I don't know why everyone keeps bothering us. Maybe some of us in this community don't want vaccine. Why do you keep bugging us? And so now, what do we say to that? We don't want it, period. Quit asking us. That's what I need help with. How do I combat that?
I mean, I guess
Because we have it. We have the vaccine. We're out there. We are trying all different strategies. When someone says to me, quit asking me, I don't want it.
Yeah. I mean, education's the only thing we can do in that, you know, say, you know, I understand that, just please, you know, to protect yourself, make sure you're wearing your mask to protect yourself and others too. I mean, you're right. I mean, we do have to kind of respect that to some extent.
We do. And that's, I guess, I don't know, Dr. Muhammad, I mean, our community, different population, but not completely.
No, I think
80% of Orange is vaccinated. So
yeah. The only thing, I agree with Maureen. Those who have made up their mind they're very less likely to change unless there's a mandate from their employer.
Yep.
Or whatever reason they have to travel and get. So there has to be a reason pushing them to get that education. I mean, we're just, you know, broken record saying the same thing again and again, and yet people are saying in our board of health, unfortunately, we have some people who don't believe in vaccine. So having said that, we just had a meeting last night to say, you know, what are you doing for those people who do not want to get vaccinated? And I'm like, you know, everybody's privy to their opinion. They may be on the wrong side, but, you know, I've never pushed anybody from my end that you must go, you say the way to kind of propose this solution is you're more likely to get sick and ending up in hospitalization if you have underlying health conditions. So therefore if you have any contraindication to vaccine, you talk to your medical provider and you go from there. So I think it's difficult, like you said, those people who just want to put the blinders and say, I don't want to hear about it. You know, you guys go to whatever we have made our mind. I think that's where we have the opportunity to look at regional leaders who are the influencer, not from social media, or maybe social media. I don't know. I mean, I'm not a social media person, but we talked about these religious organizations, religious leaders, and other important community members. I think that's the only way to get some people change their mind. You know, they speak the same language, they belong to the same ethnic background or cultural, you know, or religion for that matter. So those are my thought process. You know, I'm connected with the group in Orange, so all the chaplains and priests. So I update them once a month and all that, tell them, and everybody say that we're all following the same protocol and we're encouraging, so which is reassuring to me. And I think that type of partnership will help reaching out those folks who are part of Abrahamic faith and those, you know, institutions are there, you know, it could be a temple, mosque, and churches, you know. That's one piece or puzzle for the problem, but there are other, like I said, We need to identify those people who have influence and if it's coming from the governor, they want to ignore that. So it has to be a local person. If it's coming from the mayor, may not jive well with other.
Yeah. I think right now, having any government
it's going to cause more
speak
problems.
is going to be not something I would recommend. Not at the state level, not at the federal level. People are tired of hearing it.
Yeah.
I've been told that over and over again. I mean, not even everyone in the health department believes in vaccine.
Yeah, of course. That's
I'm
true.
fully vaccinated and boosted, but not everyone. So, yeah, I think to answer your question, how can you help? Help us get a group of church leaders or community leaders together to
find those people.
Find those people.
Yeah, and that's the tricky part. I mean, I would love to engage, those folks. If we know that there's a subsegment of population who speaks Hindi or Urdu. I mean, again, if you look at the state data, it's funny, Asian belongs to all the other Southeast Asians. They are the highest group. They're almost identical with Caucasian when it comes to ethnicity in terms of receiving. It's the Blacks and Hispanics that we're seeing a delayed, right, approach, and which is kind of very telling that we may want a native speaker or native person who is part of the community who can express. Yeah, so that's the.
I don't know that
we have the vaccine readily available when we have that conversation. I think that's the other piece, because we may have that conversation and have that leader there and sort of see, maybe somebody okay, and then it's like, okay, well, we're going to make an appointment and we're going to do this, come down the next day. So like your idea for having the CERT ban, in a community or, have.
We have it there while they're willing to go, right? Yeah. There's no time to think about it and change your mind, and it's got to be convenient. It's got to be accessible to them,
Accessible, yep, that's true.
I don't know whether this has been.
Here, so we'll just tell Joe we need the CERT ban.
Call Joe.
Hey, Joe.
Hey, Joe.
Can I just say, I don't know, sometimes I do a lot of the triage calls in the oncology office in North Haven, and there's a lot of times where I have to convince people to do something they don't want to do, and I know that it's different with a vaccine, but often I try to find their weakness, not their weakness, but will you go to the hospital for your husband because your husband needs you to go to the hospital so that you can be okay, or that kind of stuff. And I don't know that we presented it like you may not want to get the vaccine or you may not want to do this for you, but because it's so transmissible, would you do this for the children that you take care of or your elderly parents? And I don't know that it's been presented that way or not, but I don't know if that would be helpful.
No, you're right, 100%. And I think it's kind of a combination of public health through social work.
No, definitely, I agree.
Absolutely, Jean, 100%.
I had a patient who had COVID that I took a call on, and she was fine the day before and called and said, I've been really short of breath all morning, and I feel like I'm anxious and I'm panicking and whatever. And it took me a good 10 minutes to convince her to call 911. She didn't want to. And when EMS got there, her oxygen was 50.
Oh my God.
So, but again, sometimes it's not, okay, you need the vaccine or you need to do this. Sometimes it does become a part of social work that you have to sort of engage them in a way where you think you could to reach them. Yes.
Yeah. I mean, this was a strategy that I had been trying all along, because before the vaccines became available for children, I'm like, if you don't want to be, you think you're fine and you're healthy, otherwise, what about your children who cannot even get? So now the vaccines are available. That's another, option. Well, I mean, but you're right.
Yeah, I like that a lot. I admittedly have not done that. I don't have. Problem is, I often feel like my days are just one long blur. I would love to be able to sit down. I'm a trained health educator first and foremost. I would love to be able to sit down and with somebody and do that. We're in chaos mode again, and we're so understaffed. So, and I don't think honestly, no matter who you are, anyone has enough staff to get through what we're trying to get through right now.
Yeah.
But I think it's actually a thought, like we are getting additional funding, health department for this next year, and maybe hiring somebody with that kind of background, part-time, under the COVID funding, the ALC funding, to do that.
And invite the speakers from local community and give them a stipend for their participation.
I've taken a different approach to getting people their vaccine, which instead of saying, hey, there's a mandate, hey, you have to do this, like no one wants to be told that.
Exactly. I
When
feel like
someone says to
sometimes
you,
if
you
go
have to do
around,
this.
yeah, if you go around the back door sometimes,
Yeah.
I find that it sometimes is helpful. Again, not that I think that everybody has the time to try to convince however many people, but if it gets half of the people that are not vaccinated, then I don't know. I mean, it's something to think about the way we could present it. Do it for so-and-so or whatever,
Yeah, I like that a lot, Jean.
What is our current vaccination numbers right now in West Haven?
I can take a quick peek. They were stuck at
I
6.
haven't seen, I've been
They were
looking at
stuck at,
the
they were
numbers.
stuck at high 60s. Hold on one second.
That's where I thought they were last. You're muted, Maureen.
I don't want you to hear my clicking. I'm trying to get
Oh,
vaccine data. I'm gonna mute you again for a second while I. So overall, it's 71.88%. That's overall. Now that includes,
one dose.
it includes all doses, yes. Yeah, for one dose. Now there's also a breakdown there that I can try to run a report. But I can probably tell you that fully vaccinated or boosted are probably much lower.
That's what, yeah. That's what
I don't know why.
I had looked at them in a while and I knew we were kind of stuck. I thought it was low 60s, but
there's a resistance for the booster. I'm not sure why. COVID-19 vaccination. Here we go. By town. A second. Okay. Fully vaccinated. 65.47. See if there's any booster. Well, that's if you're counting booster as fully vaccinated. 39,261 people at least went for one dose. 35,761 are fully vaccinated.
And our population is 50 something.
54,620.
Yeah.
I'd like to see that up a bit.
Yeah, we're stuck. We've been stuck in the 60s for a while, if I'm not mistaken. Well, I like your idea that you had earlier, just getting out in the neighborhoods. And I agree with what you're saying is, you know, getting other people other than government folks to speak.
And no one wants to hear that. And what's going to take though to get that cert van, it's going to take, you know, the availability of, you know, all of our volunteers work. So
it's hard. Yeah.
That's the hard part. But it's a goal. It's something that we've been discussing. So
for sure. Well, we'll just keep going, keep plugging along. All right. Do we have anything else to?
I have a quick question. I don't mean to cut you off. So I'm about to schedule some more clinics through Griffin. Any, would you like to see them anywhere in particular?
I think what you're doing, Allentown, is a great place to be. I think, I mean, I don't know if where ShopRite and that, if there's anyone in that area that would host even closer to like Meadowbrook. To me, that area would be.
Actually, you know, I thought about Meadow Landing.
Because I think that would be a good place. Did we go up?
We did a clinic there at the health department.
No, I'm trying to think, like Terrace Avenue up in that area.
No, we have not.
Because that might be a place. Just trying to think different pockets of.
Is there a place on Terrace Avenue in that neighborhood where there's an indoor facility where?
I don't know if in any of those apartment complexes, they have like community centers, but I know a lot of the community rooms are closed now, right? In some places.
Because it's not, they call it a van, but it's not really, it's a car. Yeah. And they pulled up and they need a place, especially now in the cold, an indoor space to do these. Griffin.
Maybe the housing authority would know of a place up there.
I can call John Counter. Yeah.
What about like, has there anything been done near Surfside, like near the beach where all like that, the senior housing complex is?
So yeah, Cornell Scott did their first and second.
I know they're testing down there, but
yeah. I reached out to John Counter and asked him if we could help them in any way. And they didn't seem to need any. I think
Preet too.
I was just wondering.
Preet, Mercy Manor. We've seen a lot of those residents at our clinics on Noble Street.
Okay.
And Joe's doing another round of Homebound on Friday.
Oh yeah, those had to get rescheduled last.
Because of the snow.
Yeah, I feel like Noble Street here is a good place for like the Seven Rock area, and then where you were in Allentown today is for that area, but there's all these other little pockets like up by ShopRite. It's still, even though it's kind of Allentown, it's kind of far away from that location. So
in the old ShopRite where
the
UNH?
The new ShopRite. Sorry, the new ShopRite I'm talking
the new
about.
ShopRite.
It's still Allentown, but I feel like that we haven't done anything up there, and you did do one right in Meadow Landing, but that was outside, so I don't know if there's anything inside. But those are the places that come right off the top of my head. And like Walgreens, nope, Walmart still does their own clinics, right? So They do COVID clinics that
do.
people can walk into over in that little area over there, because there's apartment buildings over there. I'm just trying to think where there's like clusters of apartment buildings, people who, you know, may need something in their direct area. I don't know. Those are the things that come to my mind.
Okay.
Is there anything else we didn't touch on that we need to? So our next meeting will be the second Tuesday of February. Time is already flying.
Yeah, no.
I'll take a motion to adjourn.
Okay.
Maureen and
I
Dr.
second it.
Mohammed. Maureen and Dr. Mohammed, 7:39. Thank you, guys.
Thank
Thank
you
you.
all. Have a good
Be
evening.
safe,
and
everybody.
Safe out there. Yep, for sure.
Take care.